Hello, my name is Kat Keane, Health Educator at Arthritis New South Wales, and in this episode of Empowering You, I'm going to be talking about how to explain your diagnosis as a young person. Okay, welcome. Just before we get started, just a reminder that while every effort has been made to ensure that the information is accurate and reliable, we encourage that you consult with your GP or rheumatologist for individual healthcare and advice. This is just general information and advice. So today, this episode's title being Explaining Your Diagnosis as a Young Person for the Empowering You series. So the overview, what we're going to look at today is the misconceptions about young people, and having arthritis. And after we discuss the misconceptions, we're going to go through and understand the different types of arthritic conditions. And then lastly, which is more the practical element of this, is to empower you as a young person, how to explain your condition or tips on how to explain your condition. So the topic of the episode is coming from a perspective of a young 24-year-old, and she had just been diagnosed with psoriatic arthritis. But in saying that, this is applicable to any young person with a diagnosis of inflammatory arthritis. It was just that this young lady called, and I had an hour-long conversation with her. And one of the biggest concerns or things that upset her the most was the fact that she had arthritis, and even herself was confused about why she had arthritis, and other people coming to her going, I don't understand why you're young, you're a young person. Arthritis is for old people. Why, and what is this that you have? So while all rheumatic autoimmune conditions present differently, however, and respectively, they all stem from an autoimmune condition. So hence the reason why for addressing rheumatic autoimmune conditions collectively. But first, I'm saying I want to talk to the young people, and I just want to clarify what I mean by young for this particular episode or presentation. There are many different categories of how you can group ages throughout life. You can do it on stages, particular ages, particular developmental stages as well, events, things that happen. There are so many different ways that you can categorize. This is a general way that I've listed here on the slide. And in saying that, for example, when you look at childhood, there can be three different age brackets or categories of childhood. The same with adulthood, there can be up to two to three different, again, stages or age brackets. The same with old age. You can have old young, you can have old, and then you can have old as old. So yeah, it can be very difficult, but what I'm focusing on are the young people who are aged from 16 to 45. Now, I'm not saying if you're older than 45, you are old. Okay, that's not what I'm saying. And also for those who are under the age of 16, this can still be applicable to you, but because under the age of 16 will likely still have a lot to do with their parents looking after them and advocating for them, I haven't tailored it to perhaps the parents. And that's why I'm just saying the young person who has the condition who's from 16 to 45, okay? So the misconception, a bit of Q&A here to clarify the misconception. So that same lady, a young woman who I spoke about in that first slide, who was inspiration for this Empowering You episode. Her question or thought went along the lines of, when I explain to people that I have psoriatic arthritis, and you can insert whichever one that you have, they don't understand why I have arthritis, being the age that I am. And I feel it's because I'm young, and young people don't or aren't supposed to have arthritis. And the answer is, well, this is an all too common experience, and it's due to a lack of awareness and a systemic societal misconception of arthritis being only an old person's condition. So could be 65, 70, 80, could be anything that they consider old. It's difficult, to say the least, to change such a systemic, widespreading misconception. And while it should change, certainly, there are some simple things that you could do and say that could help people better understand your condition. And so that's what we're going to talk about today. So here are some of the main misconceptions. There may be others, and by all means, I'd love you to write into me or to call me and tell me some of the ones that you've come across. So number one is arthritis. Arthritis isn't that just what old people get, is what we hear a lot of people say. That they think osteoarthritis, which is associated with the older population, because it is one that just slowly comes on and then generally presents as we are older. Is the same as an inflammatory arthritis. Aren't they the same thing? Well, the answer is no. No, they're not the same thing. There are similarities, but their etiology, so the cause of the symptoms, are very different. I'm going to park that one because I'm going to talk about the different types of arthritis conditions in the next slide. Following on from point number one is a misconception that the disease is limited to the joints. And again, the answer is no, it is not limited to the joints. If and when you have inflammatory arthritic conditions, they not only affect your joints, but if left untreated and over a period of time, they can also implicate your organs, such as your heart and your lungs or your eyes. The third one here, misconception, kind of is that it can be seen. Just because someone is in pain or has a disability or has a condition doesn't mean that it's something that you can actually physically see. So, and in that, because they can't see your pain and they can't see your inflammation, it must mean that it's not real. Okay, you haven't lost all your hair due to chemotherapy, or you don't have a walking stick or a walking frame that tells people you have something wrong. And because of that, then they can't conceptualize that there is something wrong, or if there is, it mustn't be that bad. Okay, and that's wrong. Number four is, well, some people say, oh, just give it some time and it'll get better. The answer is no. Hang on, sorry. The answer is tricky. You can get better. So you can get treatment. You can have management, and you will likely get better. Often over the course of the disease period itself, you'll have flares where the inflammation will flare up and you'll feel worse, and then that'll die off, if you like, and you'll feel better. So the inflammation will reduce and you'll feel better. And then if you have medication, it will reduce the amount of flares and for how long you have it and the pain that you feel. But it's certainly something that you just don't brush off or walk off. It's something that you have for life. Number five, when you feel better, you can stop taking the medication. Here's another misconception. Look, the medications for rheumatic autoimmune conditions aren't nice, and they don't have very nice side effects for some. And so that even the person with the condition, not to mention the general other people as well, that just because you feel better, doesn't mean you should stop taking the medication. It means that the medication is working, and it may have popped you into remission, okay? You may not have another flare for months or years. And the reason why that might be is because you are on the medication, okay? So never stop taking your medication without consultation between you and your GP or rheumatologist. And number 6 is, following on from number 5 really is, a lot of people think or try to or want to, and I can understand why they might want to, avoid mainstream medications because of the side effects, okay? I don't particularly want to liken an inflammatory arthritis to cancer, but in terms of its treatment and management, I will, just to make the point. If you had cancer, and I do apologize if it's a sensitive topic, and you wanted to survive, the best chance of you surviving is probably following mainstream medication and interventions, which is chemotherapy, for example, or radiotherapy. Now, they're not nice. They're horrible. And no one wants to undergo those, but they do because they want another chance, or they want a chance to live longer, or they want to cure themselves of cancer. The same thing can be said for medications for rheumatic autoimmune conditions. I personally wouldn't avoid taking the medications because I don't want the worst to happen. I don't want to have my joints deformed. I want to try to maintain my independence as much as possible. I don't want to be walking with a frame, okay, sooner, you know, or later for that matter. So taking the medication reduces the amount of inflammation and damage that occurs at joints. And if you reduce that, then you may not have the side effects of the disease itself, being deformities and lack of or limitations of movement, for example. Now, to make my point, I'm going to show you a picture, and I hesitate to show the picture because it is a very severe case of what's called ankylosing spondylitis, which is a rheumatic autoimmune condition. It is an outlier case, okay? I'm going to show this, but it doesn't mean that this is going to happen to you, okay? It will not happen to you because you're going to take your medication. So here it is. He is called the folding man, okay? He was diagnosed with AS, ankylosing spondylitis, at the age of 18, okay? He did not have the means to access medications. He came from a poor family, okay? And for 3 decades, for 30 years, he was bent over like this. He's 45 years old now. Now, there is a happy ending to this story. A surgeon saw this particular case, it being one of the most severe he's ever seen, and they worked a miracle on him. He underwent multiple surgeries, and he now actually stands upright. This particular story of the folding man was actually on TV not that long ago. It was on like a 60 Minutes or a current affair or something. I couldn't quite find it, but yes, I wanted to show this to make the point of how important medication is, not to just stop it and start it, and to appreciate, yes, the side effects suck, but the side effects will reduce the likelihood significantly, or I can't say 100%, but reduce significantly the likelihood of causing your bones or your joints to deform, okay? Not only your joints, but also, you know, how it affects your internal organs, okay? I don't want this picture to instill a fear, though, that this is going to happen to you, okay? This is a very rare, extreme outlier case, okay? So understanding the different types of arthritis, okay? So let's start with the word. Arthritis, the arthro part means joint, okay? And the itis means inflammation. And it's a very broad umbrella term. And underneath this broad umbrella term, there are many different types of arthritic conditions, about 100 or so. They can be classified crudely into 3 different categories. 1, non-inflammatory arthritis, for example, OA, osteoarthritis. 2, inflammatory arthritis, for example, common ones are rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis. And then you have metabolic arthritis. So for example, gout. Now, inflammatory arthritic conditions are chronic. Osteoarthritis is chronic as well. It lasts longer than 3 months. However, the difference being that osteoarthritis isn't autoimmune, okay? There isn't an autoimmune component to it. Whereas inflammatory arthritis or arthritic conditions or disorders do have an autoimmune component. And what does that mean? Well, in conjunction with the inflammatory term, the immune system decides for some reason to attack the healthy tissues of your body. For some reason, you are exposed, you'll have a defective gene, and it is triggered by environmental and other such factors. And for some reason, your immune system, instead of, or the way in which it attacks foreign bodies in your body, like viruses or bacteria, for example, it attacks your tissues, and it does this by causing, well, it attacks them, and which causes the inflammation, okay? And because there's constant attacking of your tissues and there's constant inflammation over a long period of time, that can cause you to lots of scar tissues, breakdown of the cartilage, bone growing in sort of different ways and forms that causes over time some deformities. And it's systemic. With osteoarthritis, it's generally not systemic in that it will reside in the joint or whatever joints you may have it in, but it typically doesn't affect anything else in your body, okay? Autoimmune conditions not only affect joints, and depending on which one you have, it'll affect different joints. So ankylosing spondylitis mainly sits in your spine, whereas rheumatoid arthritis, any joint, but mainly, like, for example, fingers. But it's systemic because the inflammation that occurs can actually occur in organs of your body, okay? So big differences there between your typical osteoarthritis, which many people think is just arthritis, and your rheumatic autoimmune conditions. And the rheumatic part, sorry, is just meaning that you have a condition that causes pain and affects joints of your body, basically. Okay, so osteoarthritis is rheumatic, but it's not autoimmune. Now, they're treated with drugs. So is osteoarthritis, but not these kind of drugs. And an autoimmune condition that's rheumatic is treated by disease-modifying drugs. Most common, or the line now commonly used, is biologics. And there are many different types of DMARDs. These are the disease-modifying drugs. And their attempt is to dampen the immune system, okay, therefore modifying the disease, okay? And that's a pretty hectic drug to do something like that, okay? And so it will likely come with some side effects, but it's a spectrum. Some people don't experience side effects, and some people do, okay? Other types of drugs are non-steroidal anti-inflammatory drugs. And then there are drugs that do have corticosteroids, glucosteroids, and just general steroids. Okay, generally speaking, people with osteoarthritis will have the latter two, but definitely not the disease-modifying drugs. They're certainly not straight up anywhere, or if there's an element of inflammation. So let's get to the point of this presentation or episode, and that is tips on how to explain your condition. So this is what's going to help you perhaps going forward. Now, number one is a little bit of acceptance on your part. It's important to accept that most people won't know or don't know anything about your condition, or they don't understand it, okay? And I think that's an important concept to understand and in some way accept. And it sucks, okay? And it should change, but knowing this may help diffuse your initial annoyed, and other emotionally charged reaction to someone not understanding, because ultimately it doesn't affect them, it affects you, okay? And I can see how for some people they may feel they don't feel their condition is validated because somebody doesn't know about it, or they confuse it with somebody else. And I can understand how that can be frustrating and anger someone, because you know you're the one dealing with the pain and the discomfort of this particular condition. Okay, so I think just reframe the way you might think about it, and accept that a lot of people are not going to know about it. Hey, I know a lot about musculoskeletal conditions, treatment and management. I know a lot about psychology. I don't know how to fix a car. I don't know how to build a rocket. You know, I don't know everything, and I'm sure that you know you can see that's the same thing in yourself and other people. We just don't know. So take the opportunity to perhaps educate them, which leads me to my next point. Have a loose script prepared that might help you. So, for example, I mean, you don't have to write it out and bring it out and read it robotically word for word, although maybe that might help you, so go for it. But I think maybe having something prepared in these situations will allow you to come and articulate what the condition is accurately and concisely. I think that may help diffuse that situation. Because ultimately, in the beginning, you might not have known what your rheumatic autoimmune condition was, and you might have been really confused, thinking, "Why do I have arthritis? Isn't that an old person's condition?" So, you know, I think it's just about changing the way that we may look at things. One final tip is perhaps to avoid the wrong impression and encouraging the misconception. And while this should change systemically, try using the word or term arthritis later in your description. Here's one I prepared earlier. Now it's a bit formal, and you might like it, you might hate it, but you might like to use little bits from it. So your answer, one answer might be, I have an autoimmune condition, which means my immune system for some reason decides to attack my own body. These attacks come and go, and they're called flares. Autoimmune conditions can affect different types of tissues and parts of the body. My autoimmune condition affects, insert what yours is and what it affects for you. So what happens is my joints become inflamed, very red, very sore. I find it difficult to move, for example, and this is in response to my immune system attacking the tissues of my ankle joints and the inflammation that then occurs. For this reason, my condition is classified as a type of arthritis, since arthritis literally means inflammation of the joint. Okay. Again, a little bit formal, but you may like to use that, change it, adapt it if you like, for yourself when you want to explain it to people around you. Some other considerations may be that to help people understand your condition further, and again, you know, these conditions present differently in different people. You might like to explain to them what a good day looks like for you and what a bad day or what a flare-up period looks like for you. You know, especially people who you spend a lot of time with, you know, friends and family. If you have a supportive employer, it might be a good idea to talk to them about it, because there might be days where you don't feel like you could work an 8-hour shift on a computer. You know, it might be that you need to modify that some way, and you might need help to do so. It might be that you want to work a half day, but you spread it over the full day, and that way you're still working and you still get money and that sort of thing. But again, just from some stories we've heard coming in from the info line about telling employers about their condition, there's been some really good stories, but there's also been some bad stories. So I guess anecdotally, just tread carefully. And yeah, look, take the opportunity to raise awareness of your condition. You might like to, at any chance given, to people who aren't aware of your condition, to talk about it and educate others. Okay, so I hope that you've enjoyed today's episode of Empowering You. I hope I have in some way, shape or form empowered you as a young person to understand your condition, to validate it, and to help you perhaps educate others about your condition, and just try to break the mold of the misconception being that arthritis is an old person's condition. There are many different types of arthritic conditions, and they affect us at different ages and different stages of our life, okay? And they all should be recognized. So please send me any feedback or questions to the contacts on the screen. And thank you for listening, and take care.